We are now on Module H, the immune system. The immune system is the system in our body that defends threats, and it defends threats both inside our body and outside. Our immune system is made up of antibodies and white blood cells that function to protect the body from harmful infection-causing germs such as bacteria and virus. Our immune system also provides immunity for certain diseases. For example, chickenpox, whether we got chickenpox as a kid or we got the immunization, now our immune system helps to provide immunity so that we don't get it again. Normal findings. If our immune system is strong and working well, we can fight off infection. As we age, our immune system does tend to weaken, and that makes people more prone to getting infections. Also, as we age, we become more likely to have immune system attacking itself, causing disease. That's called autoimmune. Some variations from the normal that we want to look out for. Signs of infection, right? Because infection, immune system, if our immune system is not able to fight something off, or as it is fighting something off, we're going to have fever. A fever is a sign that our body is revving up and doing what it needs to do. It's fighting. Other signs of infection that we might see, redness or swelling, report those. Anxiety, nausea, or vomiting. Or if we see stiff, swollen, painful joints. And that particular statement there is talking more to the autoimmune that we mentioned a little bit in a previous lecture when we talked about rheumatoid arthritis. So just a couple common diseases that fall under the immune system. AIDS, which stands for Acquired Immune Deficiency Syndrome. This is a disease that is caused by the HIV virus, and it attacks the immune system and destroys our infection-fighting and cancer-fighting cells. It spreads throughout the body, including our body fluids like blood, semen, vaginal secretions, and breast milk. If we're taking care of someone who has AIDS or HIV, we need to follow both standard precautions and bloodborne pathogen precautions to protect our residents and ourselves. We want to assist with daily activities as needed, provide adequate food and fluids, maintain accurate and good intake and output, obtain weights as ordered, encourage coughing and deep breathing exercises to encourage lung expansion and clearing of the lungs. Always encourage self-care as tolerated, observe and report for signs of infection, and provide emotional support. So since AIDS attacks our body's immune system and infection and cancer-fighting cells, that's why these patients are particularly susceptible to infections. So even an infection that might just be a common cold to us could be a deadly infection to these patients, depending on where they are at in their disease process. A couple other common disorders of the immune system, lupus. This is when the immune system attacks tissues and causes redness, pain, swelling, and damage to those tissues. Graves' disease. This is when the immune system attacks the thyroid gland and causes our thyroid to actually secrete more thyroid hormone than is normal. Our role in the immune system is to observe for and report those signs of infection, following standard precautions or any other types of precautions that are put out there, provide for nutrition, hydration, and rest as needed for the resident, and make sure to support and encourage that.